Brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta ride or die.
Around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my strap, put on the beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, and now I'm running. You don't wanna follow me, now I'm in front of.
What's going on? What's going on? Happy Thanksgiving to you and good evening. Welcome to Steve the Kidney Nurse broadcast. I am your host, Steve Belcher. Please share this broadcast. It's not going to be long, about 15 to 30 minutes, unless you have questions or want to engage in a conversation. But this is not going to be long. Look, I wanted to come on tonight because I know the other kidney disease advocate content creators, they're off doing, spending time with their families for Thanksgiving. So hopefully I can get an opportunity to grab some folks, talk about AMA against medical advice at hemodialysis. If you're on hemodialysis and you've been on it for a long period of time, AMA, I'm sure you heard of it. If you ever wanted to get off dialysis, let's say 15, 20, 30 minutes, or even an hour before your time was up, the staff will come to you and say, look, in order for us to take you off, you have to sign an AMA. And you look up at them, and it's like, AMA, what's that? Against medical advice. Now, if you haven't heard of it, if you're new to dialysis, please ask any questions you want. Right now, I'm going to read a generalized AMA. They can be different depending on the company that you're at. But generally, the AMAs normally go like this. This is to certify that I'm going to say my name, Steve Belcher, a patient at, let's just say, Washington, D.C. dialysis clinic, am refusing at my own insistence and without the authority and against the advice of my attending physicians, Dr. Amos, requests to leave against medical advice. The medical risk benefits have been explained to me by a member of the medical staff, and I understand those risks. I hereby release. Now that's important. When they say I hereby release the medical center, its administration personnel, and my attendant and or resident physician from any responsibility for all consequences which may result by me leaving under these circumstances. And such of the risk of leaving dialysis or getting off early is death, high potassium, not getting your whole clearance, fluid overload. There's many problems that can come from getting off early consistently. Now, what does this AMA mean to you? I mean, of course, right? And if you have to get off, if you have to, family emergency, you got to go to the restroom and you really, really can't hold it. And that's pretty much it. Family emergency, or go to the bathroom to the point where you don't want to soil on yourself. Because if you get off because you see maybe somebody else getting off early, or you just don't feel well, or you just want to get out of here, you're almost doing yourself, you're really doing yourself a disservice, because you want to get the most treatment you can, especially if you have a lot of fluid to remove. That's very important, very important. When I worked in the dialysis field, we had patients who got off an hour early, 45 minutes early, whether it be because it was cramping, maybe their blood pressure dropped, or they just wanted to leave because they had other things to do. We try to explain that you should try to get as much treatment of your ordered dialysis as you can. That's very important. I cannot stress that enough. Now, if you look at someone on nocturnal or home dialysis, they're getting anywhere between 6 to 8 hours of treatment. Now, if you do, say, let's just say 7 hours, you do 7 hours of treatment at night at the dialysis clinic or at home, and you say you do that 4 hours a week, that's 28 hours of treatment, compared to if you go 3 hours 3 times a week, that's only 9 hours of treatment. Even if you do 4 hours 3 times a week, that's only 12 hours of dialysis treatment a week, opposed to 28 hours a week. And you can see that large gap of treatment time, where one who's getting the most dialysis treatment is going to have the better quality of life. So this AMA, I've seen patients get mad at the staff, get angry, and sign off just to sign off because they were mad. Now, again, you have that right. That's one of your patient's rights. If you want to terminate your treatment, that's fine and well. But you have to understand the consequences that you may or could suffer as a result of consistently maybe terminating treatment 15 minutes early, 20 minutes early, maybe because you say you cramping. Well, it's a reason why you're cramping, okay? Now, you're not supposed to cramp on dialysis. And if you're cramping every treatment, there's a reason. It's either you're under your dry weight, or you're over, or somewhere in the middle, but you need to correct why you're cramping. And normally that happens when one gains a lot of fluid and they try to pull it off in a short period of time. If you're, say, 3 hours and 45 minutes, 3.5 hours, and you gain maybe 3.5 to 5 liters you're trying to take off, that's a lot of fluid you're taking off per hour. Especially if you have any type of cardiac issues, you can run into serious issues. That's why we say it's very important to limit your fluid gains between treatment, especially if you're 3 hours, 3.5, 3 hours and 45 minutes. You don't want to have that stress on your body by gaining that much fluid. And then when you feel bad, you want to get off. Now you still have some toxins in you and you didn't get all the fluid off, and they're going to try to get it off the next treatment. Trouble next treatment cramping because you got to have some type of fluid intake between the time of this dialysis and then the next one. And if you don't get all that fluid off, it could build up in your lungs and over time cause respiratory distress. So the AMA, against medical advice, I mean, even I wanted to sign one when I was in the hospital, but I didn't. We all get frustrated with some of the services that now is delivered with our healthcare, and you just want to leave and sign AMA. But once you sign that AMA and you leave, cross those doors, no one other than yourself is held liable if something happened to you if you go home. Okay? So, again, if you're at dialysis and let's say your blood pressure drops, you start cramping, say a half an hour before you're supposed to come off, find out the reason. Did you take your blood pressure medicine before coming to dialysis? Are they taking too much fluid off? And that's another thing, when you weigh, I cannot stress this enough. When you weigh at dialysis, make sure you remove your shoes, especially if you have on boots, okay, or heavy shoes. It's wintertime coming up. If you have on heavy shoes or boots, make sure you take them off. Now, I know the floor is dirty. And what you want to do is you ask them for one of those blue pads. We call them chucks, with the white pad on them that they put under your arm before they stick you. You get one of them, you put it on the scale, and then you step on it. You want to take off your coat, and you want to take everything out of your pockets. I mean, everything. So you want to get try to at least get a consistent weight. Don't go in weighing with your coat on, your boots, and because that can throw your weight off. They can throw them pulling more than what's necessary. So you want to take everything off and just have on your shirt, your pants, your socks, and weigh. That way you get a close to an accurate weight with your clothes on. Also, be careful with the holidays coming up. Okay. Now, one thing these clinics like to do, which unfortunately, when I worked, I partook in this activity as well. When it's around Christmas, New Year's Eve, any holiday, we want to get out of there and get home to our family. So they cut treatment time. Now, you want to find out at your clinic, what's their holiday schedule? Are they cutting time? Okay, you definitely want to know that. And you want to get all your treatment time during the holidays, because we know we may go to Christmas parties, holiday parties. We may eat a little extra. You may have something that may have a little extra sodium on it. You may be a little thirsty. So you want to get all your treatment time. Okay. You may get a note from the facility saying they're going to start early and all patients running 3 hours or something like that. That may or may not happen. And with some patients, they find that happy that they can get their time reduced. And I understand that completely. But don't sell yourself short. Don't sell your life short. Okay? Get all the treatment you can. And I sincerely mean that, so you can get the best quality of life you can. There's a lot of people coming on hemodialysis, and you just want to make sure that when you go into this treatment, you want to have all the information you need to be armed to deal with this process for the longevity. Okay. And if you know any warriors, have them come and watch this broadcast or any other Reach Media Network. All we want to do is educate. That's all. Educate, educate, educate. You can't get enough of it, because the more you know, the better you'll be and the better prepared you will be when you go to treatment, when you may be in a clinic and you go to a clinic that has multiple people coming through there working because that clinic may be short of staff. You want to know what your treatment orders are, how much heparin you get, how much medicine are they giving you? Are those the right size needles? How much are you taking off on my machine? What's my blood flow rate? Is that the right filter? You want to know all this, because I granted, mark my word, that if it's not your clinic, it's someone else's that's going to be short of staff, and they're going to have people coming through there that you never seen before. And you're going to be saying, what's going on? I've never seen you before. And they're going to introduce themselves, and then they're going to initiate your treatment. They may get it right, they may not. But the more you know, the better you'll be prepared. Let me see if I got anyone who joined my chat. Okay, let me go to my overlays. I got Jared Brown, thank you for joining me. Monica Goldberg, Richter, thank you. God bless you. Let me go up to the counter. I got Alexis, thank you for watching. My friend Federico, thank you for watching. Thank you for tuning in with your family. Yes, please share this. We got to get that information out there. I've advised you to also look at Alexis McGee Ashford, who's also a kidney healthcare professional advocate, such as myself. Let me see. What does Aquino say? My clinic is opening now on Saturdays for those that want to get off, then want to. Wow, they open on an extra day. Wow. Okay. This is what I'm talking about. Ty says, I've gotten a new Oh, congratulations, man. Congratulations, Terry. Congratulations on your transplant. Yes, Monica, the dry weight. Absolutely. And I mean, would Alexis say, or use napkins in case the staff complains about? Yes, absolutely. So also, Alexis is dialysis personnel as well. And just like myself, she tries to educate, or she does educate to patients down in the Gulf region, down in the Mississippi area where kidney disease is off the charts. Mississippi is one of the top 10 states in the United States that is flourishing with kidney disease. One of the top 10. So this is not a DC, Maryland, Virginia, New York, Delaware, Florida, Georgia, Texas. This is a United States and a global issue. A global issue. And then how do we help our brothers and sisters overseas that have lack of supplies? Meaning they get less dialysis than someone here that may get 3 hours 3 times a week. How do we encourage them to keep fighting when the clinics they go to have lack of supplies, lack of resources, and they got to go on the black market and find their own supplies to come dialysis? This is why I do what I do, because it's not fair. Healthcare for all, regardless where you're at. There's enough money globally to go around to help folks who deal with this disease on a chronic basis. Let's see what Monica says. Not that one. Okay, let me go down to the new message. Hey, Lisa Baxter, as another advocate kidney warrior, when you coming back on the air? I guess you retired. Sean Doe, when you coming back on the air? Lisa Baxter, I'm calling you out of retirement. We need wanted kidney advocates. There's not enough of us. We need y'all guys. So, Lisa Baxter, when you coming out of retirement? But anyway, wait a minute. So one thing I want to say before I go, with the dialyzer, make sure you know your size. This one is a 160. It's an Optiflux 160. Okay, that NR means no reuse. Right there, no reuse. 160. Now, they have multiple dialyzers like this. Find out which size you're on. You could be a 180, a 200. And again, this is a 160, a 180, 200, 250. When you start getting the higher up dialyzers, those for like large size patients. And so just make sure you know what size on. So when you go to your chair and you see someone new there, you want to know they set up the right filter, because they may not have looked at your orders. They may have just grabbed stuff, and it happens. Also, if you got a catheter, make sure whoever's taking care of you, again, if that person is new, make sure they changing your catheter dressing. It's supposed to get changed each treatment. Okay, make sure they flush each limb with 10 cc's of normal saline. And if you're supposed to get heparin packed in there, make sure they pack it with heparin. That's very important. Also, if you get stuck with a needle, make sure when they put the needle in your arm that they're using a 2x2 to cover up the needle site and not tape. You don't know where that tape been. That tape got germs on it. And if you got this needle in and you got an open hole and they got the tape over it, your access could possibly get infected. I'm not saying it will, but it can, depending on where that tape is. Okay? So make sure they put a 2x2 dressing over your needle, tape it down, and then use the butterfly method when they tape in, where they tape it, put the tape under, and put each tape down and put the tape across. Okay? Very important. And look, the reason why they should be putting heparin, some places may not do it, but they should at least flush it. And the reason why, because at the end of this, can you see these little holes? Get my pen here. These holes right here. That hole right there, it gets clogged up with fibrin, which is the blood. So when this is in your vein and you're running dialysis after each treatment where we return the blood, if you remember, when blood is outside the body, it clots. Have you seen blood on the floor? Have you ever spilled blood on the floor, or a technician wasted your blood on the floor and it started to gel up? It was starting to clot. Well, it happens with these accesses at the end of this when they flush the blood back and everything. It tends to build up around these holes, the fibrin, and it steadily builds up and it occludes or it blocks these holes. Now the blood can't flow through them. And so that's why if you got a catheter and if it haven't worked, they put the syringe on and they try to aspirate and they tell you to breathe. Take a deep breath. Take a deep breath. And they try to pull and they put you all the way back in the chair. And you're like, oh my God, damn. And you're all the way back in the chair and they trying to pull, the nurse trying to pull and it still won't come out. Then they like, okay, you either got to go to the access center or we're going to use what's called activase. Okay, or urokinase, which is a streptokinase, which is a blood stripper. It just strips it and just takes it away. So we'll put that in there and have you sit for about 45 minutes, right? And you're sitting there 45 minutes to an hour. You're watching TV. You wonder when the hell they coming back to start my treatment. Whatever the case may be, your treatment has been interrupted, okay, for 45 minutes. And look, let me tell you something. If this happened to you in the future where they got to stop your treatment, make sure they add that time back on, because some of them don't add the time back on. So if you're running, say, 3 hours and it took 45 minutes to get this catheter work, you only ran 2 hours and 15 minutes. Go figure. You tell them to add that time onto your treatment. A lot of patients don't think about that. They're not thinking about that, right? They putting it in the technician's hands. But do you think the technician want to add on 45 minutes to your time? That means you're going to come off after the other patients and they're going to be late. So don't fall for the okie doke. But what I wanted to say is once we put that medicine in here and after 45 minutes to an hour, we come back and we pour and magic, blood is coming out. Again, the reason for that, and a lot of times you tell them to use that medicine because a lot of times when that happens, they try to send you to the access center to get it exchanged. Now the access center is getting paid money when they could have put the medicine in and you sat there for 45 minutes and then had it working again. Just to make sure they putting heparin in so to prevent that from happening. Again, a lot of patients don't see the inside of, of these catheters, so they don't know what's going on. And like I say, these little holes, that's what's causing the catheter to be occluded, because thrombin or blood sticks to that. It sticks to this, okay? And now it's occluded. So just know that. A lot of patients don't know what I'm saying because staff don't take the time to explain it to them. That's why we try to get you to come to the Urban Health Outreach Media so I can tell you, I don't have a dog in the fight with these companies anymore. I don't work for no corporate company. I'll tell you the secrets of the trade, what you want to know, that's going to help prepare you or make your life a little bit more easier. That's all. Because ever since I started dialysis, working in dialysis, from day one in 1985, I always, and I'm not blowing smoke up your butt, but I always put myself in the patient's position, because that can happen to me one day. Kidney disease has no name on it. In fact, I have kidney disease stage 1 that's managed. So no one is exempt from this. You could be in a car accident and trauma could shut down your kidneys. COVID, medication. It's not just diabetes and hypertension anymore. Those just happen to be the 2 leading causes. So if you find yourself in the position of needing kidney dialysis and you're getting mixed information, you don't know where to turn, you can always come here to the Urban Health Outreach Media Network, to the Urban Kidney Alliance. We have ton, and I mean ton of information. I have amassed and accumulated over 37 years of information and content ready to share with any kidney warrior or family member or anyone wanting to learn about this process of hemodialysis and kidney dialysis. One more thing. So, the Kelly clamp on your line near your saline, make sure one of these clamps are on there. Make sure you see a clamp where they give you the saline, where they open it up, they give you the fluid right there by the blood pump. Make sure they got one of these on there, not just the line and not just that it's clamped, but make sure it's double clamped so your bag don't run dry by mistake and then you get air in your system. And then this is the 2x2 I was talking about. Make sure they put one of these over your access. Fold it up and put it over your access when they put the needles in. All right. And then again, the needles, 16 gauge needles. Staff are supposed to open it. You open it like this. So now they're not sterile anymore. They're sterile in here. One thing you want to make sure when you come to your seat and they have these needles already open and laying on the chucks or the pad, make sure these plastic caps are on. Okay. The thing is green, so that's why you can't see it. And I have a green screen. But make sure these plastic caps are on if these are out of the package. Because, again, if this cap is off, now this is exposed to germs. And they're about to put the needle in your arm. And so germs are going to get inside. So you want to be careful. That can cause a graft infection, because you know the graft is a man-made tube inside your arm. And so that's easily to get affected than a fistula, because a fistula, you're using your own veins. When you use a graft, you got a rubber tube and something that looks like this, but a little bit more flimsy, okay? And it's in your arm. It's implanted in your arm. And so when you're sticking the needle in this, right? Again, man-made. You got the needle, and if the needle's dirty, it can affect the graft. I cannot tell you the many horror stories and patients that I met that had an infected graft or access, and that comes from poor infection control procedures. Okay, when the staff is cleaning your arm, make sure they're really cleaning and not just going up and down with the alcohol pad, but make sure they're using several and they're going in a circular motion from inner to outer, getting the germs from the inside and carrying it away. Okay, make sure they, especially if they got those little small alcohol pads, make sure they use about 4 of them to clean your arm in the circular motion, not in the same area, but coming in and going out, going out, going out. You just want to play it safe inside these clinics, and I'm trying to give every nugget I can think of right now so you can be prepared and armed. Even if you got to go to treatment tomorrow and you don't know anything that I told you tonight, and this is your first time hearing it, hopefully it would prepare you so when you go in, you can be more proactive. And don't worry if you ask the staff something and you feel like they're going to like boss up on you, like, why you need to know that? This is your treatment. They're there to serve you. You have a right. There's patients' rights and responsibilities. A packet that you get when you first start dialysis come with the consent admission packet. Patients' rights and responsibilities. What's your rights as a patient? And then what's your responsibilities as a patient? And one of those rights is a right to be involved in your treatment plan. And what that means to you is if you feel like, if you monitor your labs and say you 4 hours and then you signed off at 3.5 hours and you was monitoring your labs and everything, and you saw that you was still achieving the same results at 3.5 hours than you were at 4 hours, you had the right to consult with your nephrologist and talk about it and let them know that you want to change your hours. A lot of patients and family members don't know this. And that's why it's very important, if you still have your patient's rights and responsibility forms, your admission packet when you first started dialysis, I encourage you to go through that packet page by page and look at what your rights are, what your grievance rights are, if you have a grievance. Because now I'm hearing more and more patients are starting to get blackballed. In fact, 1,000 patients, yes, 1,000 warriors are blackballed or involuntary discharged from their dialysis unit each year. And we don't hear about it, but it happens. It just recently happened to a cousin of mine's friend in Virginia. He can't go to no hospital unless he has an emergency. He can't go to no more facilities We don't know what he did for that to happen, but that's murder. You know this man needs treatment 3 days a week, and now you prevent him from getting outpatient treatment at clinics in the area. And he's only allowed to go to the hospital when he has any type of heart problems. This is murder. And yet this is what these companies are doing. There would be another show for that. So again, learn all you can about your treatment. And if you need more information, come here at Urban Health Outreach Media and Urban Kidney Alliance, and we would definitely give you that information. Let me go back to my chats before I go. Hang tight as they pop up in the overlay. Lisa Baxter, hey Lisa. Hey Tiffany Bell, thank you for joining. Lisa Baxter, when you coming back on air? All right. Thank you, Tiffany, for watching. Happy Thanksgiving to you, Lisa. Let's see. They don't want to tell you about your treatment. I have not had that. Wow, you're right. You're right, Monica. So, all right, guys, I went over my time. I thank you for listening. God bless you. Please tune in tomorrow right here at 8 p.m. It's Uncle Jim with Kidney Stories 2. You don't want to miss it. He's going to have on kidney advocate Austin Lee, who mostly advocates for pediatrics. So that's tomorrow night, 8 p.m. Eastern Standard Time, right here on the Urban Health Outreach Media Network. Thank you guys for watching. God bless you. Have a nice holiday. Peace and blessings. And we will definitely see you soon on Steve the Kidney Nurse. I'm out. Peace.
Brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta ride or die.
Around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my strap, put on the beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm in front.